Hello friends, I am Dr. Rakesh Sahay. I am a professor of endocrinology at Usmania Medical College in Hyderabad. I will speak to you about twin cretins. So as we are battling through this pandemic of both diabetes and obesity, we call it as diabesity. To tackle this, we need newer and newer tools, better tools to manage this epidemic of diabesity. And today we have something called as the twin cretins. The twin cretins is a term used to describe this combination of a GLP and a GIP analog. This is an engineered peptide which has got effects on both the GIP and GLP receptor. The one which has actually progressed, there are many of them which were developed, and one which has seen the light of the day, or rather got approval for marketing through FDA is tirzepatide. So this molecule has got unique effects. I mean, in the sense that what I would like to say is that if you look at the incretin effect, which we are all familiar with, we see that there is a better insulin secretion when a glucose load is taken orally as compared to when it's given intravenously. And the molecules mediating that are GIP and GLP. One, GIP is more important, although it was not used hitherto, because of the fact that GIP, there is some resistance to GIP in patients with diabetes. And today, with this new molecule, what we have seen is that this new molecule has got a structure of GIP and a fatty acid side chain attached to it. It has a long half-life to be given once in a week subcutaneously, and with that, what we see is that it produces a significant benefit in terms of the glycemic control and also weight reduction. So these are two major benefits that are there, which are much better than the available GLP-1 analogs. The reduction in HbA1c is to the tune of 2%, more than 2% in the HbA1c reduction across different trials which are conducted in a program which was called the SURPASS program. In that program, different studies were conducted. 6 different studies were conducted with using this molecule as a monotherapy, as an add-on to metformin, as a comparator, with the comparison with the degludec, comparison with glargine, or as an add-on to glargine. And one more was where it was compared as an add-on to glargine versus where it was compared with Lispro. So across all these studies, what we see is that the reduction in HbA1c was to the tune of 2 to 2.5%, so which is very impressive, and the reduction in weight was even more remarkable. And the reduction in, the number of people who were able to achieve a goal of less than 7% HbA1c was close to 90%, and close to 40-45% patients could achieve a target of less than 5.7, which is making them absolutely normal, or we could call it as a remission of diabetes. And about the weight loss, what we see is that more than 5% weight loss was seen in close to 90% people, and about 45 to 50% of people could achieve a weight reduction to the tune of more than 15% again. So these benefits were seen with very low side effects. Again, the side effect profile was similar to GLP-1 analogs, with nausea, vomiting and diarrhea being common side effects. However, the nausea is little lesser than what we see with GLP-1 analogs, and it comes down with time, over time. The other adverse events which were also looked at were hypoglycemia, which is very low, and the other adverse events seen with GLP-1 analogs was also not significant. So we have a new molecule which is likely to become a game changer. It is likely to become a molecule of the future, where we are going to see significant benefits in terms of glycemic control and also weight reduction, which is very much needed today. Thank you.